Hello, this is Marisol, living with schizophrenia. And in this episode, I'm going to talk about the side effects of the medications that I've listed in the previous video. So, the medications that I take, for example, Depakote, has a list of 20 or more, and that's for all of these medications right here. All of them, 20 or more listed side effects. For example, I've listed some down: diarrhea, blurred vision, fever, diarrhea, headache, confusion, constipation, hair loss, difficult of labored breathing, bleeding of gums, etc. 20 total side effects. For Depakote, I was having a lot of tiredness. They had to lower the dosage, and also weight gain was one of the side effects of Depakote. And I was trying to lose weight, so they reduced the milligrams from 500 to 250, so I would be able to start losing some weight. Propanol, I use that for akathisia, which is shaking, uncontrollable shaking, which I have a little bit of. And I feel fatigue. That's one of the side effects that I feel from propanolol. But it's to help with the shaking. And so, because you have uncontrollable or involuntary shaking at times. So, that medication stops the shaking but causes fatigue. Lexapro, there's increased sweating and no libido. So Lexapro is used for it's a medication used for depression, usually. And I noticed, and just being on medication, it I have no libido. So, and I think that's a lot with antipsychotic medication. That's just one of the side effects. Risperidone, I remember I was having acne, back pain, drooling, and I was weight gain when I first took it, and I had gotten out of the hospital. I was in pretty bad shape. It was due to an episode I had about 2 years ago, and thankfully I'm off that medication, but that was some of the side effects, although it was helpful, and it did bring me back to reality. Abilify, sometimes I can be irritable at times, so that's one of the side effects that I have for Abilify. Then there's Abilify Maintainer, which is the injection, which I'm presently on, which it's tiredness and blood pressure. I do have high blood pressure, and I was checking to see if that was one of the side effects, and that is one of the side effects. So when you're taking antipsychotic medication, just be aware that there are side effects. You want to know which ones you have and so forth. So if they become too much, you can consult with your doctor and have them change your prescription or lower the dosage. I had to do that. That's why I'm just on right now on Abilify Maintainer, because I used to take Invega for schizophrenia, but the side effects were too much. I was having tiredness, loss of period, um, lethargy, just low energy, and depression. So then they switched me over to Abilify Maintainer, which is much better injection, less side effects. Risperidone, I'm not on anymore. Abilify, I was taking it before I was given the injection, just to see how I would transition over to the medication. So the tablet form was given to me before the injection. Risperidone I don't take. Lexapro I don't take. And that also increased sweating, so I would sweat a lot more. But I just do overall. So I mean, I'm not taking Lexapro anymore for the depression. Thankfully, I'm in a much better mood because Depakote is a mood stabilizer, so it's helped with my mood, and it's helped with feeling less depressed. And so those are just some of the side effects. Again, thank you for listening and staying tuned. If you like this video, or if you know someone who's also struggling with mental health illness and is on medication, feel free to like, share, and subscribe. And see you in the next video where I discuss more about medications. new medications that I might have to take in the upcoming months. But for now, thank you for listening and stay blessed.